Hello, everyone. My name is Evan Coleman, and today I want to present to you my health and technology e-portfolio. Before I get into it, a little bit about me. My name is Evan Coleman, and I'm a sophomore wellness management major here at SUNY Oswego. I'm looking to pursue a career in physical therapy, and I'm also very passionate about health and fitness, which is what drew me to my topic for the semester, being heart health. In today's presentation, I'm going to give an overview of heart health as well as the disparities that have risen in this health field. I'm going to talk about the technologies that are being utilized today to enhance this field and give the most success for improving heart health. And I'm also going to showcase the webpage that I designed and a brief summary of the semester. So as I stated, my topic is heart health. I selected this topic because heart disease is the leading cause of death in the United States, but I feel like there is much that can be done to improve and prevent heart disease. I feel that the biggest issues are knowledge and access to improving heart health. And throughout this semester, my goal was to give people an understanding of these technologies and give a highlight to what I feel is some of the most successful in this field. Due to the nature of heart disease occurring later in life, my target population was middle-aged and older adults. So looking at the disparities in heart health, I utilized research from the University of Arizona Health Sciences. And essentially what they explained was that African Americans and Hispanics have the highest risk of developing heart disease in their lifetime. Along with this, African American men and women develop heart failure at higher rates than other racial and ethnic groups, and African American women have the highest proportion of heart failure. Looking at the reasoning for these disparities, it can be contributed to three main factors. And the first one is that a high percentage of the statistical people for the heart failure are residing from areas of lower socioeconomic status. And what this automatically does is it puts them at a disadvantage for access to quality healthcare. Now, along with that, we have healthcare provider bias, and we have a decrease, or in other words, a lack of racial slash ethnic groups being utilized in heart health research. And what these two factors are going to do is it's going to result in treatment options that aren't tailored for these populations. If you don't take into account all the populations that may be at risk for heart disease, then it already puts them at an unfair advantage because they're not going to be getting the treatment specifically tailored for them. My target population, as I stated, was middle-aged to older adults. Looking at it from a year standpoint, I was looking at 40 to 65 years old. Uh, According to Memorial Hermann, approximately 82% of cardiovascular disease deaths occur in individuals 65 years old or older. Now, the reason I consisted of individuals under this is because heart disease isn't a disease that occurs overnight. So I wanted to, this semester, I primarily looked at the prevention and detection of heart disease. So I wanted to look at individuals that were more in their 40s and 50s that could make a change in their life to prevent heart disease before it occurred. How disparity affected my target population? As I stated before, individuals in my target population who are African American or Hispanic are going to have the highest risk of developing heart failure. And looking at how we can decrease these disparities, uh, I looked at a study by the University of Florida, which really emphasized that cultural competency is going to be key in this. And what cultural competency is the ability to provide care to patients with diverse values, beliefs, and behaviors, including tailoring delivery of care to meet patients' social, cultural, and linguistic needs. So, like I stated before, pretty much we need to view health more specifically than broad. And if we're not including all races and ethnic groups, then they're going to be put at a disadvantage because they may have different needs than other populations. And if those needs aren't addressed, it's going to hurt them. So current heart health trends, uh, due to heart disease being the leading cause of death in the United States, it is a topic that is greatly viewed, and there are a lot of technologies utilized to improve heart health. But as I've stated several times throughout this presentation, I feel that access and knowledge of these technologies is the biggest struggle. But taking a look at these technologies, we have mobile applications, wearables, heart rate monitors, as well as exercise programs for prevention. And we also have treatment for individuals who have accumulated heart disease, such as stents, which I'll talk about later in the presentation. Now, in shedding light on a technology, I wanted to look at something that would work to lower the disparities that I've spoken about. And I felt that utilizing a mobile device as a tool would be best to bridge this gap between people of a lower socioeconomic status and above. Uh, Explained by Ray VR, founder of Health Champion. He talked about how 81% of American adults own a smartphone. So utilizing a device like this allows a level playing field for individuals to receive quality healthcare. And an example of how they could do this is through telemedicine, which would allow for doctors and nurses that are of minority to serve members of their cultural group from all over the country. As I talked about that cultural competency and the ability for people to understand populations, if people can be connected to healthcare professionals that they feel have a better understanding of them, then it's going to give a higher success rate in addressing their health needs. So other than telemedicine, there's also just the utilization of a lot of apps on mobile devices that are successful in helping people in heart health. Cardiovisual was an app that I wanted to shed light on, and more than being an assessment tool, it's an educational source for heart health. And it not only talks about lifestyle choices to increase heart health, but it gives people a full overview of the structure and function of the heart, conditions and treatments that they may obtain throughout their life. And it really just brings a lot of knowledge about heart health. And it's, as I like to think, knowledge is the first key to prevention, because if you don't know what you may be at risk for, then why make a change for that risk? And looking at the advantage to this is access. Like I've stated, I think knowledge is something that people may not get in their life, and without that knowledge, they're already put at a disadvantage. So with this app only being 99 cents per month, they're getting a full source of everything they need to know about heart health. And it allows people in these lower end socioeconomic groups to get the education they need. The disadvantage is that although the app is only 99 cents per month, you do need a smartphone to download the app. And in today's age where it's very common for people to have a smartphone, there still is people without. And that automatically deems them unable to have cardiovisual. Here's an example of what cardiovisual looks like on a mobile device. Now, every technology should be assessed to make sure that it is truly successful. And in assessing cardiovisual, I would use a health belief model. And I feel this model would be most effective because cardiovisual is used from an educational standpoint. And what the health belief model does is it allows healthcare professionals to understand populations' understanding, perceived susceptibility, perceived severity, and their self-efficacy level to make a change based around a certain illness or disease. So for the example of cardiovisual, I think what would be best would be to evaluate people's actual self-efficacy to take action and improve their heart health after using the app. If people utilize this app and they still have no motivation to improve their heart health, then it wouldn't be successful. But if people use cardiovisual and they've learned much about heart health and it's a true motivator for them to make change, then we would know this is a technology that should be utilized. Now I'm just going to run through my web page that I developed through this semester. It's called Healthy Heart Life. So here it is. Let me see if I can move my image to show the website a little bit. So Healthy Heart Life, health is now. Our mission statement at Healthy Heart Life is to enlighten people on heart health and give them access and information on the newest technologies and trends in heart health to ensure their health is in check. Our vision statement at Healthy Heart Life is for people to value heart health as a top priority in their life and lower the curve of heart health related deaths. And we follow that with a little more information, which then brings us to our blog page. And here, this just gives access for people to go to our blogger.com page and view the blogs that I wrote throughout the year. So on the left, we have our blog on the Achievement app, which was an app that encouraged movement throughout the day, as well as how AI is using fingerprints to save lives. And this talks about fat radiomic profile, which is a tool to prevent heart attacks. And I'll talk about that later. This is our videos page, and I just have a brief piece talking about how the videos were posted on YouTube and Vimeo. And then we have the 3 videos here that I developed throughout the semester. We have a video on how middle-aged adults can exercise to prevent heart disease, a PSA on mobile fitness apps, and a video on wearables and heart rate monitors. Lastly, we have our social media and about page, which just shows a little bit about me, our contact information, which is healthyheartlife@gmail.com. And then we have a link to our Twitter page, which is to post when we have new YouTube videos and new blog posts out. Before I leave our site, I'll show you guys a video that I developed throughout the year. So I'll show you my PSI on mobile fitness apps. Today in 2021, many people associate the use of mobile devices with sedentary behavior and laziness. But the key to removing this stigma is to find a bridge between physical activity and mobile devices. There are many reputable training apps to choose from, and the Nike Training Club is essentially a personal training app which comes free of charge and offers over 185 in-depth workouts for any level of experience. This app received the Editor's Choice Award, and it has over 239,000 ratings with an average of 4.9 out of 5 stars. There are many training apps to choose from based on your goals, experience, and preference, but be sure to favor apps that have a good rating, regular updates, and some sort of recognition from the App Store. Daily exercise comes with tremendous benefits, such as the release of endorphins and serotonin, the decrease in stress hormones, as well as an increase in self-confidence. People finding the ability to utilize their mobile devices as a tool for exercise and health is the key to bringing together technology and physical activity. With a device that people already use for hours on end daily, one of the best decisions is to use it for the betterment of your body. So right there was just another example of how mobile devices can be used as a tool for heart health. Now I'll come back to our presentation here. So throughout the semester, I assessed a handful of technologies used for heart health. And among those, some of my highlights were the stent, mobile fitness apps, which you just saw in the PSA video, fat radiomic profile, as well as wearables and heart rate monitors. So stent is a dissolvable mesh coil that's placed in an artery. And as people live their life with poor lifestyle habits, plaque may develop in arteries. And what that's going to do is put a lot of pressure on the heart. And what a stent does is it's placed in the artery and it opens it back up to allow more blood flow. Mobile fitness apps, which I just spoke on, there's many of them that can be utilized to give people a tool to encourage physical activity. And if they're not sure what types of physical activity they should be doing, then they can utilize it as an educational source. Fat radiomic profile, what that does is it scans one's thumbprint to predict their chances of a heart attack. It's pretty fascinating, and it's a technology that a lot of researchers are claiming is the most effective and efficient way to predict heart attacks. And its goal is to be implemented into all hospitals by around 2025. Wearables and heart rate monitors are another technology that's seen in people who may not even be looking to increase their heart health, because they're found now in a lot of watches and electric watches such as the Fitbit, Apple Watch, Samsung Watch. And heart rate monitors essentially just allow someone to view their heart rate throughout the day. And this data can be accumulated and shown to a healthcare provider if they feel there may be abnormalities in their heart rate. And it just gives someone a better understanding of their heart. So throughout the semester, I utilized YouTube, Vimeo, Twitter, and Blogger.com as my main platforms. And I had a reason for these platforms, which was mainly access. So for people that viewed my Healthy Heart Life page, I didn't want them to click on a link that brought them to some sort of site where they needed a membership or an account. I wanted there to be a smooth access point. And with these platforms like YouTube, Vimeo, Twitter, Blogger.com, they could click right on the link and then see the information that they were looking for. Recapping on the semester as a whole, this semester gave me the opportunity to view many technologies in the field of heart health. And what this showed me was that we're headed in a very positive direction. Not only is there a great amount of technologies now, but I was able to view a handful of technologies that are going to be released in years to come that a lot of healthcare professionals are excited about, and it's only going to increase the field. The main struggle that I saw was ensuring that all populations are going to have access to these technologies. And I don't have the answer to how we can do this, but it certainly is something that needs to be addressed, and people need it to be brought to their attention. The most interesting topic to me was wearables, as I feel this is just the beginning of the incorporation of technologies just being worn all day to give people information on their health. I think it's unbelievable that we could wear something on our wrist all day and have such an immense amount of data about our heart health. And I think this is only the beginning for technologies like that. And I'm excited to see where the future goes for that. As for technologies in health promotion and wellness, I feel just like with the rest of the world, uh, as technologies become more incorporated in our day to day life, they're going to be more incorporated in health promotion and wellness. This semester showed me that technologies not only give us a better understanding of patients and individuals' health, but it allows for health professionals to have smoother communication, more efficiency, and it overall increases the workplace for medical professionals. And if we can bring technologies, top-notch technologies, into all all parts of the world for health, then we'll be in a good place. Thank you for watching, and I'm just going to show you guys my references here, as we have research from the University of Arizona Health Sciences, University of Florida, Health Champion with Ray VR, as well as a study from the CDC. Thank you.